Fox Business interviewed one of the union leaders attending the meeting with the president this afternoon, Leo Gerard. He is president of United Steelworkers International. Mr. Gerard, good to see you. Thanks for being here. Are you concerned that the so-called Cadillac plans are now becoming Chevrolet plans, as somebody said? That is, they're hitting people at much lower and lower levels.
Well, first of all, I'm concerned that we've started calling them Cadillac plans. What they are expensive plans. And in many cases, these are plans that affect workers in difficult industries, affect groups of workers in small communities where they can only choose one or two insurance companies. It affects workers that are on average or a lot older. For example, in the Steelworkers Union, we have 250,000 of our members that are in what's called Voluntary Employee Benefit Associations, or VEBAs. Most of those workers are between the age of 55 and 65. These kind of discussions about these plans could have a massive impact on those retirees that are in those plans. So they're expensive plans, and I think we're going about it all wrong. We ought to get those that benefited from the last 8 years, that huge tax cuts, we ought to get them to step up and do a little bit so that middle-class workers aren't taking this on the chin and that retirees aren't taking it on the chin.
Mr. Gerard, Senate Democrats are in essence saying that by taxing Cadillac plans, which I know you don't like the term, but that's become part of the lexicon here, that it'll help curb health care.
Why don't we just call them expensive plans?
Expensive, exactly. Will help curb health care spending because it will discourage costly plans. What are you going to tell the president if you get your opportunity in this meeting?
Well, look, I think that that's a myth that's been created. Just like they said, well, if you have expensive plans, that it'll force higher copays. A higher copay is coming out of the worker's pocket anyway. And the fact of the matter is that these plans are expensive because of the demographics of the workforce, of the ability to access health care. They're not expensive because people have too much benefit. They're not expensive because people have too much health care. And by the way, let me tell you, if I have a heart attack, I don't want my wife to go into the book and go through the yellow pages, see who's going to give us the cheapest deal. I want to get quality service. And I think we all ought to have the same service. That's why we were for a public option.
All right. Now, let me just ask, because it is the Senate plan that is going to be would like to tax at 40% excise tax on these so-called Cadillac plans. The House version has the surtax of 5.4% on couples earning more than $1 million. You want the Senate to accept the House plan for this 5.4% surtax on millionaires?
I think that the House plan is certainly, by all measures, much more equitable and a fairer part of what would go on in our society. To have health care for everyone paid for by people who are barely hanging on to their health care now is bad public policy, it's bad economics, and it's certainly not good politics. The fact of the matter is that it's asking people that make collectively more than $1 million. Those are the people that benefited from the huge tax cuts of the last couple of President Bush's term. It's not unfair to ask them to put a little bit more into the pot.
Yeah, there is that belief that those are the people who benefited over the past 2 terms of President Bush. But again, when you get in that meeting with President Obama, you'll probably get some convincing, at least he'll try, because he's supportive of the Senate plan. He definitely wants to get something through. And what are you going to say if he says, look, this will hit those higher level people, because I guess individuals it's about $8,000 or $8,500 for a health plan, and $23,000, more than $23,000 for a family health plan for these so-called very expensive ones. What will you say to the president?
Well, I'll say what I just said, that this is bad public policy, it's bad health care policy, and it's bad politics. The fact of the matter is that this is, and I don't want to blame the president, I want to be really clear about that. This is not the plan that the president wanted. This is the plan he's been saddled with because a couple of Democrats, Joe Lieberman and Ben Nelson, along with the Republican caucus, have decided that this is what they were going to try to ram down America's throats. And again, this is not the right way to do public policy on health care, is to get those people who already have health care, who in many cases are just barely hanging on to it because they're in expensive areas, whether it's age, demographics, or workforce, whether it's location, to tax them and force them into worse plans or force them completely out of the health care system. That's just wrong. It's not good public policy.
All right. Mr. Gerard, we got to have you back. Leo Gerard, International President of United Steelworkers of America. Please come back and see us again.